Hey guys, I hope you had a good weekend. What we're going to do today, right now, is I'm going to finish up reading your slides for chapter 20. That doesn't mean we're not having Zoom class tonight. I wanted to go ahead and get these slides read through so that we could actually code together this evening, because I put together a little coding packet for us so that we can actually be together and code and just see each other and encourage one another. So I'm going to go ahead and pull up my share screen and share with you guys and begin to finish off these slides. I want to let you know that this starts on page 522 of your step-by-step manual, and we're talking about male genitalia system, the anatomic subsection. So the subsections that we're going to be talking about through these slides is the penis, the testes, the epididymis, tunica vaginalis, scrotum, vas deferens, spermatic cord, seminal vessels, and prostate. So the subsection format is actually incision. Oh, let me move our slide, sorry. Incision, destruction, method used, and if it's simple or extensive, excision, introduction, repair, manipulation, suture. Our biopsy codes. The codes for biopsy are located under the anatomical subheading in which they refer. For example, biopsy codes in subheading are going to be epididymis excision or testes excision. Going to talk about the penis a little bit. The incision category under penis subheading differs from the codes in the integumentary system subsection, and that the penis incision codes are used for deep incision, not simply for abscess of the skin. The incision category codes are 54000 through 54015. Our destruction codes. Destruction 54050 through 54065 codes are divided by extent, which would be simple or extensive. Method of destruction, chemical or chirosurgery, and extensive destruction can be by any method. Excision. Excision is 54100 through 54164. The most commonly used codes are biopsy and circumcision. The appropriate circumcision codes are always based on the method and the age of the patient. Biopsy, penis, simple biopsy is 54100, and the complex is 54150. Peyronie's disease. What is Peyronie's disease? Peyronie's disease is the curvature of the penis as a result of plaque formation. The surgical removal of this plaque is going to be 54110 through 54112. Grafting may be necessary to correct the defect, and you're going to find those with 54111 or 54112. If a harvesting graft is needed through a separate incision, you're going to see codes 20920 and 20926. Circumcisions. Circumcision descriptors now include a code for circumcision using a clamp or other device with a regional dorsal or with a regional dorsal penile or a ring block. Circumcision codes are divided by neonate, which is 28 days or less, and older than 28 days. The clamp that is used for circumcision retracts the foreskin while it is being trimmed. Excision of the foreskin without clamping is typically sutured after the removal. So, introduction. I'm sorry, 54200 through 54250 The introduction category includes many procedures involving the corpora cavernism. Such procedures include ejection procedures for Peyronie disease and treatments for erectile dysfunction. Injection of steroids help to decrease the pain, deformity, and fibrous tissue size. 54240 and 54250 have a global professional, which is a 26 modifier, and a technical component, which is a TC modifier. Use of appropriate modifier is important when assigning. Now we're going to move straight into repair. The repair category includes many plastic repairs. Some repairs involve more than one stage. So some repairs are staged more than one, and you're going to use a modifier 58 with those. Stage indicated in the code description. So you're going to know what stage it is by the fact that you're going to be able to abstract that from your medical report and match that up with your code description. Repair of wounds involving the skin and subcutaneous tissue of external male genitalia. You're going to see the integumentary section, 12001 through 13133. Corty and hypopedasis. If I say that differently every time, please forgive me. It's a tongue tire for me. There are degrees of hypopedasis. The degree depends on the location of the opening, whether it's anterior, middle, or posterior. Hypopedasis can lead to corty. Corty is the downward curve of the penis. Hypopedasis is a congenital abnormality. Urethral medius is the opening is abnormally placed. Repair codes report repair services for corty and hypopedasis. So we're going to talk about the testes. Excision 54500 through 54535. Biopsy, excision, orchiectomy. So what is an orchiectomy? That is the removal of the testes. Biopsy incisional or percutaneous. Orchiectomy codes reported by simple or radical, unilateral or bilateral, with or without testicular prosthesis insertion, and the approach used. If the procedure is done bilaterally, a modifier 50 would be used unless the code is specified as bilateral. So we use the bilateral modifier if our code doesn't specify it's bilateral. Okay, so our exploration codes are 54550, 54560. So you can find undescended testes in this section. Congenital testes or testis or testes did not descend into the scrotal sac. Can be unilateral or bilateral, and often they're associated with a hernia. The repair is going to be 54600 through 54680. Orchopexy, moving and fixation of the testis to the scrotal sac. Abdominal approach is 54650. Laparoscopic is 54692. Code selection is based on approach, ingenual, scrotal, and abdominal. Sorry. So if you guys want to open up your CPTs and start looking at some of that, you're going to be able to put that together a little bit better. Epididymis. Okay, only 4 categories are in the epididymis subsection: the incision, excision, exploration, and repair. Code 54700 is for an abscess or a hematoma of the testes, scrotal space, or epididymis. So epididymis is a narrow coiled tube on top of the testes. It connects efferent ducts to vas deferens. deferens, vas deferens. IND abscess or hematoma is going to be 54700. Your excision category is 54800 through 54861. Biopsy, lesion of spermatocell cyst. Repair category is 54900 and 54901. An epididymovasectomy. Report operating microscope separately with the 69990. Tunica vaginalis. Like the epididymis subsection, tunica vaginalis contains only 3 categories: incision, excision, and repair. All are for treatments of hydrocele also. Okay, tunica vaginalis is a serous sheath of testes. Site of hydrocele are the fluid collection, unilateral or bilateral treatment options such as aspirate, inject, excise, repair. Repair bottle type repair is 55060. Drain, reposition, and catheter left in place. Now we're going to talk about the scrotum, 55100 through 55180. The scrotal sac, or the scrotum, is the sac that contains the testes. If an incision is performed on a lesion of the skin, remember you're going to refer to the integumentary system because it's on the skin, not inside. It's not internal. Skin flaps may need to be used to repair the defect after a scrotoplasty. If a simple skin flap is performed, this is included in the procedure. More complex grafts are reported separately. Vas deferens. Tube that conducts sperm from testes to the ejaculatory duct and urethra. The incision, vastotomy, to collect sperm sample or identify obstruction. Excision is a vasectomy for sterilization procedure to describe as either unilateral or bilateral. You do not use a modifier 50 here. Introduction, dye for radiographic procedure. Repair, remove obstruction. Anastomosis, ends, semen sampling included. Operating microscope is once again 69990. Now we're going to talk about the spermatic cord. Okay, the spermatic cord is a collection of structures that suspend the testes in the scrotum. You can kind of see that up at the top there. The procedures in this subheading are either performed excisionally or laparoscopically. Watch separate procedure designation. Only billed if only service performed, or if procedure totally unrelated to another procedure performed during the same session. Now we're going to move on to our seminal vessels, 55600 through 55680. Seminal vessels are a pair of bands posterior to the bladder. They provide a majority of semen fluid. Incision is a vasculotomy. Simple is 55600, then your complicated is 55605. Excision, vasculectomy, for removal of tumor, calculus, or other obstruction. 55650 is any approach, and add on 50 for bilateral. So we're going to be talking about our prostate, 55700 through 55899. Okay, so what is BPH? Benign prostatic hyperplasia, which is the enlargement of the prostate. Here are treatment options. Urethral stent keeps urethra open at the level of the prostate. 55282 is permanent. 53855 is temporary. TUMPT 53850 is microwave heat, and tuna, which makes me smile every time I say it, 53852 is radio frequency. Each code description lists approach and bundled procedures if appropriate. So I'm going to ask you a question and I want you to write it down. I'm going to answer it for you. That way I know that everybody's listening to their slides. What are some symptoms of BPH? Benign prostatic hyperplasia. Urinary frequency, urgency, nocturia, decreases in force of urine stream, and feeling bladder not fully empty. So that's your question. What are some of the symptoms of BPH? I want you to submit that to me after you listen to your slides, please. Incision. Okay, prostate biopsy. Needle or punch is going to be 55700. Needle transperineal stereotactic 55706. Incisional is 55705. When fine needle aspiration biopsy performed, refer to 10004 through 10021, which is your integumentary system. Prostateotomy 55720 is simple and 55725 is complicated. Drain the abscess either via perineum or through the rectum. Complicated equals documented complexity such as excess bleeding. Do not report a needle or punch biopsy with an incisional biopsy during the same operative session. BPH or neoplasm surgical options. Oh, I'm sorry, I went one too far. So a Terp. Here's your second question to submit to me. What does Terp stand for? Transurethral resection of the prostate. A TUIP, transurethral incision of the prostate. So your Terps are 52601 and 52630. Through the urethra, electrical loop removes obstruction. A TUIP, incision relieves pressure and no tissue is removed. A prostatectomy. Okay, so there's two types of codes: coagulation, 52647, and vaporization, 52648. Vaporization may be with or without resection. Use a laser to accomplish the prostatectomy is either considered coagulation or vaporization. Okay, so coagulation causes the tissue to die and slough off. Coagulation laser, 52647. Contact or non-contact? Non-contact laser does not come in contact with the prostate. Contact laser does come in contact with the prostate. A tulip, non-contact, non-direct view by surgeon. During a tulip, there is no visualization of the prostate, and the penetration isn't as deep as other methods. VLAP, non-contact direct view by surgeon. The VLAP is done under direct visualization by the surgeon. ILCP, contact, no direct view of the surgeon. Prostatectomy. Vaporization is done through electrical currents. So laser vaporization, 52648. TUVP or TVP or contact electrical current vaporizes tissue by means of a ball that is rolled over the tissue. Laser vaporization with or without resection is 52648. The HOLIT or the THLR contact laser resects tissue with holmium laser fiber. $55801 through 55845 are open surgical procedures. They're first based on approach, perineal, space between the rectum and the scrotum, suprapubic, above the pubic bone, retropubic, posterior to the pubic bone. Second, based on extent, subtotal, or radical. So what does a prostatectomy mean? That's another question for you. What is a prostatectomy? It's the removal of the prostate. Subtotal removal means anything less than total, and radical removal means total removal of the prostate. LRP is 55866, laparoscopic retropubic prostatectomy. LRP stands for laparoscopic retropubic prostatectomy. A substitute for an open prostatectomy may be an LRP. RAP, no CPT code. Or RAP is a robotic assisted prostatectomy. Is new and is used at times with the LRP. It assists in performance for some surgical tasks. Use a modifier 22 with the 55866. Brachytherapy, 55860 through 55865. This is typically performed in conjunction with a urologist and a radiation oncologist, with a urologist and a radiation oncologist. Methods: high dose, temporary method, low dose, permanent method. Placement: transperineal, 55875, and open exposure, 55862. Radio elements reported with 77778 and 77799. Oh, that's the end. That's the conclusion. So I hope you guys enjoyed the slides and the recording again. I'm just going to kind of show you that when we have our time together on Zoom, we'll be doing this little coding packet together. And so that's why I wanted to go ahead and do the slides now so that we would have time to code. I hope you guys have a great day, and I will see you guys about 6 o'clock.